I have a great association with doctors from all over the world that are really the top in their field, especially in what's called integrative medicine, or how do you take natural treatment and natural methods and mix them with medical therapies to create the best outcome. I had a patient come in recently who's an older gentleman, and he's got just this really strange progressive memory loss. And he's seeing a conventional neurologist, and he's got really good doctors who really care about him, but they have limited information about integrative medicine. So he's got a memory loss problem. He's taking a statin drug for his cholesterol. Never had a heart problem, never had a circulatory problem, but he's taking a statin drug. Statin drugs cause memory loss. He's taking a sedative pill to go to sleep at night. They cause memory problems. His MRI showed no changes in his brain, except maybe a little bit of circulatory stuff over time. And those kind of problems, they can be improved with natural treatments like ginkgo, fish oils, things that improve circulation, L-arginine to the brain, things that detoxify the brain. There's a new thing called NRF2, NRF2, which is an inflammation modulator for the brain. It will reduce inflammation in the brain. Acetyl l-carnitine, Glyceryophosphocholine, Phosphatidylserine. They're big words that really impress you that I'm a doctor. But they're also compounds that produce neurotransmitters that reverse memory loss in a lot of people. The bad news is that all those drug therapies, the conventional therapy that is used for memory loss, tends to create other problems. Fainting, increased risk of hip fracture, blood sugar abnormalities. They're potent drugs. Lots of doctors use them, and I'm not questioning their judgment. I'm just saying if it's possible to use natural treatments, if it's possible to remove drugs that cause memory loss, that's the first step in addressing memory loss. Before that first step is sitting down with the patient and asking the questions. Sitting down with their family and asking them and making sure that you got the whole story. Well, I got the whole story. And the whole story is lots of drugs that cause memory loss. Let's get them out of the picture. Let's see what we can do by removing the toxic stuff, removing the drugs, adding the natural things, increasing activity, and then holding off on these other drugs for memory until we're sure that we've removed everything else that's going to create memory problems that we can get rid of. And then when that's all done, we can consider that stuff, get a great neurologist, get a good psychologist, a good internist, and a good guy who does integrative medicine like me who can put it all together. And I think the outcomes will be surprisingly better. And when it comes to memory problems, people are not necessarily stuck. It's not a terminal condition. It can be turned around and often is. So if you want to read a good book, there's one called Grain Brain. It's about inflammation in the brain by Dr. Perlmutter. A lot of good data through his system is really available. Conventionally trained doctor who does integrative medicine and neurology, he's great. And if he's not your doctor, get with your doctor because we're better together.